Gynaecology Basic Concept 1 Ovary follicle oocytes Life of oocytes 24 to 48 hours and life of sperms 48 HRS/3 days At the place of ampulla with sperm it get fertilized and it called embryo in the fallopian tube there is embryi which capture the oocytes from ruptured follicle and bring it to the ampulla of the fallopian tube and there it meet with the sperms and get fertilized then the embryo reach uterus at 3rd to 4th day after the fertilization and implantation takes place at 6th to 9th day after fertilization. If concept 2 for the implantation the endometrium should be proliferative and secretory. The proliferation of the endometrium is done by the estrogen. The secretory process is take place by progesterone. The proliferation process done for 14 days called follicular phase. The secretory process is done for 14 days so totally menstruation is done for 28 days equals 14 plus 14. The estrogen is produced by the follicle for the better implantation. It proliferate the endometrium after the ovulation. The balance follicle sac become corpus luteum which is yellow in color and that produce the progesterone. Ovulation is rupture of the follicle and release of oocytes into the fallopian tube. If woman is not pregnant until the 9th day after ovulation the corpus luteum which continuously producing progesterone will start withdrawal/degenerate. At the 14th day they completely degenerated and prostaglandins start contract the uterus muscle and the endometrium proliferate and secretion lining will shed through vagina called period. The shedding is take place for 3 days. Pain bleeding recover. Concept 3 The name dysmenorrhea is pain in the menstrual cycle and this is physiological pain. The main dysmenorrhea reason is due to contraction of uterus muscle in small not dilated cervix. The contraction of muscle try to dilate the cervix so it will cause pain. BCZ due to the contraction we can able to shed the endometrium shed. That's why I called it physiological pain. And in menstrual cycle another one pain is also there. This is due to the ovulation. In ovulations, the rupturing of follicle leaks some amount of blood that get into the pouch of Douglas and irritate it and cause pain. It is called Mittelschmerz. So in menstruation pain will occur 2 times, one at ovulation and another one uterine contraction done by prostaglandin. At the time of rupture of follicle there will leak of blood and release of prostaglandin and that get into the circulation and get into the endometrium lining of uterus and stay there. When the progesterone is withdrawn the prostaglandin is jumped to the myometrium and start contraction for shedding. Concept 4 From hypothalamus the GnRH will release and it will stimulate the pituitary to release the FSH and the FSH will choose the follicle for pregnancy. That's why it called follicular stimulation hormone. Then the follicle is chosen and that sends signal to the pituitary for release of LH. The signal is estrogen. BCZ it is endocrine gland. The messenger is hormone only. The estrogen is an hormone. The estrogen tell the pituitary to release the LH. The LH will come and rupture the follicle to release the oocytes and that go into the ampulla of the fallopian tube and wait for fertilization. In the follicle there is cell called granulosa cell that only produce the estrogen. In older women above 60 the granulosa will decrease. The estrogen will also decrease and leads to decrease in femininity and the estrogen are the cardioprotector in the women. So after 60 chance for cardiac problem in women is high as equal to men. Points young girl length of cervix is 3.5 to 4 centimeters. If cervix is not that much long the pain will more severe in periods. That 3 days short cervix less than 2.5 centimeters more pain and possibly abort chance is high. Pouch of Douglas is B/W. The uterus and rectum